So far everything is clear, doctors. Any questions so far in understanding all this discussion which we have discussed so far? Okay. So I want to say only one thing. You need to build up a strong your format if you want to manage your time. And because we have a lot of questions in our given time, and how wisely you can use, you should finish your history taking part after including introduction within 7 minutes. If you are if you will be able to finish your history taking part within a 7 minutes, consider yourself you are almost past this station. Consider yourself. If you will spend too much time, okay, then a lot of skills you will lose in coming time, the remaining time. Because why? You need at least 7 minutes. So you need to put each and everything. Yes, personal history, of course, I have mentioned in the slide. So first concern is always difficult to answer because it takes too long to answer this. Like this, what's going on with me? Whatever the condition is there, you should answer like this based on your history and examination. I have a few possibilities in my mind about your condition. It might be some gland problem. It might be a problem with the tummy or a problem with your gut. So what we are going to do now, we need to run some blood tests and investigations, scans of your body. Once the result will be available, and we will sit together and make a management plan. Most likely you will be treated under that specialty. So it's too long. So time manage is very important. If you finish your history taking part within a 7 minutes, 4 minutes for the examination, and 4 minutes is always very less by me. We are not used to do the fluent examination, so we need to think. But you can cope these your skills on the bedside by attending the patients and know the first thing is know how to examine. This is the first thing you need to build. According to each symptom, each complaint, you need to have a different scheme of examination. This is not like a general physical examination and you are going to perform with on each and every case. No, this case is entirely different. In this cases, you have minimum 35 to 45 complaints, different complaints, or each and every complaints have different approach of examination. You need to learn, you need to work, you need to practice those particular complaints and their relevant examination. If you don't know the relevant examination, then you are in trouble. Why? uh, the first skill you will lose this skill A, physical examination, and the second skill you will lose the identifying physical signs. If you don't know the physical examination, it's interconnected with the identifying physical signs. So if you are not able to identifying the physical sign, you have very narrow margin in these 4 stations, 6 stations, or 24 marks. You need to at least score 14 marks to pass this specific skill B, identifying the physical signs. So nutshell, you must be aware of the clinical approach, clinical examination approach of each and every complaint. This is very important to understand. If you do a physical examination in a given time and you will identify the physical sign, then your next process will be concern. Again, you're answering the questions of this surrogate. What's going on with me? This will I get better? Or sometimes is it a cancer? So whatever the concerns are there, there are few 4 marks are there. You need to fulfill that criteria, then your time will be finished. And 5 minutes you will sit with the examiner, and examiner asking a few more questions. Present your case. Most of the time they are asking you, give me positive data. You need to just give a few things, You need to use that particular data which you have provided outside the station. So my patient name, Miss Sarah, 27 years old, presented with the joint pain. This already you know from the outside. Then give the OD para or some few positive finding. This patient is having tender joint and also shortness of breath. There is also history of red eyes. So all put together. So I have a couple of differential diagnoses. So your differential diagnosis must be on the fingertips. These differential diagnoses you can make when you are preparing your card. So differential diagnosis, 4 marks again. And this is the area where a lot of candidates are unable to score their PACES examination overall scoring. You know, differential diagnosis, many candidates fail on this skill D. So in upcoming session, inshallah, we will try our best to make a sensible differential diagnosis with for each and every complaint, so that we can fulfill this criteria and full this skill. And then coming to the next question, how you're going to investigate this case. So this is a fixed format of how to investigate any case. There is a fixed format: baseline investigation and the specific investigation. Baseline investigation in any case will remain the same. You need to just save your time. You just need to be fluent. Then the specific investigations according to the symptom, according to the cause. Then how you're going to manage this case? Again, two parts: management, general management, and the specific management. General management is almost always is same for all: patient education, patient counseling, lifestyle modification, social psychological support. If the patient have some joint problem, then physiotherapy, occupational therapist, and social health worker. So these are few things which are fixed for every case. If you see, if you are not looking every case in a same manner, then you need to think a lot of investigations and a lot of management plan. I will do this, and then I will, take time. You will think, I sir, I will do this. Okay, what next, sir? I will do this. So to avoid this, situation, you need to be very fluent. We will mm, we will discuss a format of fixed rule of investigations and full fixed rule of management plan, so that you will get a maximum marks in these two skills. Clinical judgment is when to admit the patient, when not to admit the patient. So this is a very important task, and this is very always a tricky task. Candidates, they don't know when to need to for the admission. Remember one thing: if you're dealing with any neurological disease, okay, you can admit the patient. If the vitals are not stable, you can admit the patient. If the patient is having some dehydration, you can admit the patient. There is no harm. You can justify this. Why you're going to admit this patient? Sir, patient is having low blood pressure and patient is dehydrated. If there is a neurological, what kind of neurological symptom we can, we have unilateral vision loss, double vision, headaches, okay, backache, and backache is coming to the domain of rheumatology. Bilateral weakness of lower limb and unilateral weakness. Recently, a case came in the UK 2 days before. Hypertension, stroke in young, 34, 8 years old. I think lady was having right-sided weakness and she was taking some kind of OCPs. So this is very tricky, but you make a little bit flexible rule. If the patient having vitally unstable, if the patient is having any kind of neurological disorder, I'm going to admit this patient. Otherwise, you can be tricky. You can ask the patient, you can tell the examiner, so I'm going to run some blood test and I will keep you in the short stay of the hospital when the result will be available, and I will guide you better in this regard. So this is another tricky way to escape this from this problem. Any questions so far regarding this slide and regarding this format? If you will not ask any question, I will consider that you are not an active listener. Why? Because being a candidate, there are a lot of questions in mind always. How to deal with that particular problem, how to deal with the sympathy, empathy, how to deal with the ODPARA, how to deal with the associated local question. A lot of questions always in mind. If you have any question in mind, please do ask, so we can discuss and we can, clear your concepts. This was the basic agenda of today's meeting.
Dr. Azhar, I have one question.
Yes, please.
Uh, if we are taking drug history of the patient and he says that, for example, I'm using tablet prednisolone or delta-cortel or any other medication, so we have to
Mhm.
ask complication related to drug use. For example, do you have any bone pains and do you have any excessive hair growth or weight gain like this? Do we have
Mhm.
to ask that?
Mhm. Good question, doctor. Actually, if the drug is related to the particular system, particular problem, okay, which you are dealing with, then it's very important. Otherwise, you just ask for how long you're taking and how many tablets you're taking. If it's related, for example, the patient is having backache and the patient is on steroids. So it's very
Okay.
important now. It's very important now to ask. If the patient is taking steroids and he is presented with to your hip joint pain, pain in legs, or some eye problems, okay, if patient
Okay.
is coming with the hematemesis and he's also taking steroids, so is there any relation between them? There is a relation. So then you need to ask each and everything about the drug. If it's not related to that particular problem which the patient surrogate is having at the moment, there is no need to ask, no need to waste your time over there.
Okay. Got it. Thank you.
Yes, yes. Why? Because they do mention RCP. What's their requirement? Their requirement is focused history and focused examination.
Okay.
You understand? You understand now?
Yes, I got it. Thank you.
For example, now I give you one more tricky thing over here. For example, you have dealing with a patient and he's having joint pain. For example, okay, and you have 10 differential diagnoses in your mind. And after fourth or fifth question, you realize that this patient is related to SLE. Okay.
Okay.
For example, you get a clue. You got a clue that according to the history, patient is any. I mean, is he is related to some SLE? What you will do? You will complete your 6 upcoming questions, or you will go with the flow and go with the SLE.
Okay.
What you will do? My question is to you.
Um, I will go with the SLE and check all his ask about all his complication and related organ system involvement.
This is the only way, doctor, you can save your time. If you have one clue, please take that thread and follow that thread and do each and everything that about regarding that particular problem. If you feel that patient is having SLE, okay, SLE. Tell me about the mouth ulcer. Do you have any soreness in your mouth? Do you have alopecia, hair fall? Do you have any difficulty in breathing? Do you have any mood changes? Do you have any jerky movements of your body or shakiness on your body? Do you have any racing in the heart? Do you have any loose stools? So you will then check pick up this particular problem, and leading role will be the SLE, and you fulfill every criteria, every question regarding the SLE. Okay,
Okay, got it.
that's in this way you can save your time. Otherwise, this long clinical consultation is it's a very difficult task. 15 minutes, a lot of skills, examination, concerns, management plan, investigation plan, differential diagnosis, introduction, you know and the most important thing need to know is that all in English. There's no native language. Only
Yeah.
with the examiner, if you are appearing in you are appearing in Pakistan, then you can talk in Urdu only while you are going to examine the patient. Otherwise you are not allowed. So it needs a lot of practice to be very fluent and to be very vigilant, and a lot of jargons which we are using in our daily life. If we speak 2 or 3 jargons, so it will affect our communication skills. One jargon may be acceptable, but 2 jargon they will cut your 2 marks. This skill is having only 4 marks. So jargon-free language, simple language, layman terms, then this will help you a lot. And try to speak wisely, speak less, but Your word matters a lot there. Give a little bit information, but give sound information. A lot of candidates I have seen that they are talking more and more, but relevant information is very less. Give relative information at that time. You have done your task. They're not looking at your from where you are coming and what you are doing, where are you working. No, they have specific marking criteria. If you touch that criteria, they will give you yes. Okay. Remember one thing again, this exam is only do and don'ts. Either you are doing, either you are not doing. And identifying physical signs. Yesterday I think I was in class and I have stress on this. Please don't cook any physical sign from your side. If you are not comfortable with that sign, please be silent. Don't put in your clinical findings. Okay, because it will affect your overall scoring very badly. We are thinking, okay, if we put a physical sign and it is not there, and then they will deduct only 1 mark. No, they will deduct your double marks. If you will not mention, they will deduct only 1 mark. If you are giving a wrong physical sign, so you are in trouble. They are writing in their feedbacks. He identified a physical sign which is not there. So be careful in that particular. And during a format, just please again this after general questions, this wafer stand for weather preferences, weight change. Weight change, I am not using the word weight gain or weight loss. Be sensible. Weight change, weight might be increase, might be decrease also. A for anorexia, what about your diet? Fatigue, F for fatigue. Okay, are you getting fatigue? Fever, do you have high body temperature? Along the fever, always do ask fever, night sweats, lumps and bumps. 3 questions will rule out acute infection, chronic infection, malignancy, tuberculosis, HIV. You are in the safe zone. If you put 3 questions in a row, do you have any high body temperature? Fever is a jargon. Fever is a jargon. You need to ask, do you have high body temperature, night sweats, lumps and bumps? Then I for itching, R for rash, any rash on your body, anywhere from head to toe. Racing in the heart, then ask about the sleep. What about your sleep? Is this particular problem is disturbing your sleep or not? S for snoring, do you snore at night? And S for sweating, do you sweat more than usual? After general question, go immediately ask about the impact on job and social life. But what I can suggest, what can I add in this impact? Ask about the 3 impacts always: job, life, and driving. Does this condition is affecting your daily life, your job? Do you drive? Finish. You have done with your. This is a actually patient safety, patient welfare. If you're not asking this red box, you are in trouble. You are not a safe doctor. Then personal history, smoking, alcohol, okay, and drugs. Remember the SAD, SAD, SAD. Smoking, alcohol, drugs, party drugs, okay, recreational drugs. If the relevant history is there, then you can ask the traveling history and tuberculosis history, contact with the tuberculosis, and then go for the examination. So this is what, how can you tackle, how can you use your 15 minutes? Introduction must be fixed for every case. Agenda must be fixed for every case. Sympathy, empathy words must be fixed for every case. This must be a difficult time for you. I will try my best to sort it out and help you accordingly. I can understand it is very hard to have such news, but I'm here to help you and support you. Be sure we have a professional team of doctors here. We have a professional staff here. We will take care of you. Don't worry about that. These are the fixed words. In communication, in long clinical consultation, you can throw up these words and you will you will collect a marks. You are very sympathetic, empathetic. Why I'm talking about these words? What's the importance of these drugs? These words. Let's talk about now one more thing which we are ignoring while we are practicing. I can, I would suggest all of you when you are practicing with any of one of your colleague, either physically, either by telephonic conversations, please ask your friends do marking according to their skills, and they should provide you a marking answer sheet how you are going to perform today. So this will give you every day a new lesson, new dimension, and you will understand after 1 week or 2 weeks what areas you are feeling deficient and which area you need to work more. So physical examination is very important. There are skills of exam. It's basically exam is exam of skills. PACES stands for, again I am telling you, practical assessment of clinical examination skills. So no gupshup there, no extraordinary knowledge. They don't require from you any extraordinary knowledge. You need to fulfill superficial knowledge. Why? You will read the your scenarios and look at your role always during practice. You are a SHO, you are a SHO, you are HO, you are ST1, ST2, means you are a medical officer there. So they are preparing you as a medical officer, as a house officer. So you must behave like a house officer. House officer is not a consultant, so he should not fulfill all the criteria. Whatever they are asking you, if a patient is coming to you, for example, with the headache, are you safe doctor or not? Are you good doctor or not? Just ask about, red alerts. Does this headache increase with the sneezing, coughing, and bending forward? Do you have any throwing up and any sickness? Sickness means nausea. Throwing up means vomiting. So these are the jargon. These are this translation for those who are new in PACES. They don't have maybe jargon list. So vomiting is a jargon and nausea is again jargon. So you need to avoid these two words. Very frequently we using these words, so need to avoid. So physical examination, skill A, physical examination having total 24 marks. You need to secure at least 16 marks. Identifying physical signs, again 24 marks. You need to secure at least 14 marks. Communication, clinical communication skills. This is a skill when you are taking the history and you're giving delivering the information. Elicit appropriate and comprehensive history relevant to the clinical presentation. Look at the wording there. Relevant to the clinical presentation. In a professional manner. Assess impact of symptoms and identifies patient preferred management plan. So I told you the red box. You remember? Impact on this job, health, and driving. Assess impact of symptoms and identifies patient preferred management plan. You cannot implement any management plan on the patient. What I was using the word, once the result will be available, we will sit together and make a management plan. Okay, so preferred management plan, patients preferred. Explain clinical information in a clear, structured, comprehensive, and professional manner. This is what, when you are sitting with the patient and he is asking you what's going on with you, with me, so you are delivering the information in a professional manner. Again, differential diagnosis, tricky and very important skill D. We are learning every day. You need to build up a differential diagnosis with each and every complaint by yourself. It's a tricky task. It's very easy task. Yesterday I was discussing with the student. I asked them, so spend your 1 or 2 days, take a 40-30 complaints and search only according to that particular complaint. For example, patient is having joint pain, wrist pain. So what possibilities are there? There are 6-7 differential diagnoses almost written in any book. Just write down on a separate copy. Okay, heading of differential diagnosis. No need to reread from any other notes. I preferred to build your own notes. You have a sufficient time in your exam in October, I think October and November. Am I right? So you have sufficient time. Spend 1 or 2 days, understand the format of examination first, then go to the words. Understand the format of communication, then start communication. Understand the basics of clinical examination, especially station one, this short station, then go to the patients. And my humble request to all of you, don't go with your colleagues. No need to perform any unsupervised case. Why? If you are wrong today, you will be wrong after 10 days, after 30 days, after 90 days. Ask the seniors and do a supervised case, especially in the initial days. They will correct you and make your scheme, organized, and then build your uh, reflexes on those particular schemes. These are very important. Then clinical judgment, how you are going to investigate, how you are going to manage this case. So this is called clinical judgment, and how you are going to admit the patient or not. Again, this skill, having 24 marks, you need to minimum 15 marks to clear this skill. Managing a patient's concern. So listen carefully, always don't interrupt, don't implement, don't talk too much when the surrogate is asking you something. Stop everything, just listen to the surrogate and always appreciate the concern. I highly appreciate your concern. Don't go for confrontation. Don't be rushy. Don't rush towards the concern. Listen. Take a step back, listen and understand and deliver the information. Why? Maybe you know a lot of things, but what surrogate is asking, we need to that chunk to provide the surrogate at that time. Patient welfare, again, the next skill, G. Welfare is very important. 28 marks you need to secure at least out of 32. But many candidates during practice, they are so well, they are securing 30 or 32 or 32, and it's easy, very easy to do. It's all over the practice. So this is what I wanted to say about the long clinical consultation. Am I clear so far, doctors?
Yes, it's clear.
Yes.
Okay, is there any query, any question? Okay, this is the first part. Now coming to the second part. Second part is communication. Communication is very important. I want one candidate must be with me so we can be interactive with that candidate and we can discuss. Any volunteer, come forward, please, and we will start discussing with you. And I will give you the information and how we are going to perform. Dr. Hanan, are you there?
Yes.
Okay. Dr. Hanan, are you with me, right?
Yes.
Okay. Dr. Hanan, we have this case and you are in an exam. Now you are sitting outside and you have 4 minutes. How you're going to prepare this card? What's your first priority while you are going to prepare?
The name of the patient and age.
Okay.
And then the complaint, the main presentation.
Okay.
Okay. The medication, and I would put in my mind the side effect of medication is taking, and after that, my task.
Okay. And then your task. Okay.
Mm-hmm.
Okay. So you will write on the patient name, Ms. Tamara, 62 years old, and you will write down the complaints, so dizziness and faint, and you will see what is the past history and the vitals, and you will see your task, right? This is a sequence.
Yeah. Mm-hmm.
Okay. Okay. So I would suggest you in a different way. If you are dealing with any communication, what must be your first task? First thing you need to do. What is that thing? You need to read carefully. Okay. Then identify the category of communications. Okay.
Mhm.
Tell me what is the category of this patient. Just a minute. No, just a minute. Just a minute. This is not that what we are talking about. Okay. This is a patient. Okay. For example, this is a communication card. I'm sitting and I was provided by this card. So what my task is there? So this is your role is you are a doctor in the GI clinic. Patient is Mr. Alex Brightman. You have been requested to speak with the patient by consulting physician. Physician asks you to discuss few things with this patient. Okay, Mr. Alex Brightman is a 35 years old patient who has been experiencing recurrent abdominal pain, bloating, irritable bowel habits for the past 6 months. After thorough evaluation, including ruling out other causes through the appropriate test, the consultant diagnosed Alex with the irritable bowel syndrome. Talk to the patient, tell him about the diagnosis and any answer his concerns. Okay. Dr. Hanan, tell me what is the category of this particular scenario?
I lost. Yeah, inform him about his diagnosis.
Okay.
Yeah, it is functional.
Yes,
Category?
this is a category. Yes. You are absolutely right. This is a category of functional disorder. You are very right. So your task, what is your task now?
Diagnose.
task
Tell the patient. Yeah.
Yes, tell the diagnosis and address his concern. Very nice. So how you will, you know, prepare your cards? First thing you need to see what is the category of that particular problem which you are dealing with. Why? Because each category has a different approach. You cannot go with this one approach for all, communications. Never. Otherwise, you will suffer. Am I clear?
Yeah.
Okay. So first thing you need to see what is the category and what is your task. This is the first most important thing you need to identify. Then see what's the patient name. And then next thing is that what's the diagnosis and are you talking with the patient or relatives? Then see where are you sitting, in GI clinic, in ward, in emergency. Okay. Then just write down in the middle, in anywhere, the data provided to you about the patient. Look at the data, what the data you can collect, and you can write down on the paper when you're preparing this card. Before entering the room, look at here. So he has experienced abdominal pain. So first thing is abdominal pain, bloating, second thing. Third thing is altered bowel habits for last 6 months. Write down all three things for 6 months. Now coming to the investigation, thorough evaluation. Write down thorough evaluation. Write down every test has been, all tests done, and all scopes done if there is mention. Finish this. You have done with your card now. How you're going to prepare every card? This is a sequence of card. How to prepare the card outside when you are going to face a surrogate during communication. Okay, Dr. Hanan, am I
Yes.
clear to you?
Yeah.
And you can build this scheme every day when you're practicing with your colleagues. Give each other 5 minutes or 3 minutes. I think 3 minutes more than more than enough. Give 3 minutes to each other. Share cards with each other and prepare the card according to the examination protocols. Don't take it for granted. Oh no, let's talk. No, it's not like that. Your format is very important.
Mhm.
Okay, Dr. Hanan, can I ask
Yes.
one more question to you?
Please.
Okay, how you're going to approach this card? Any communication, how you're going to approach?
Introduction, I'm going to introduce myself and confirm his name.
Okay.
And after that, I'm going to ask him if he needs anyone to be with him right now.
Okay.
And after that, I'm going to talk about the agenda.
Okay, then?
Yeah. Then after that, I will ask him what did he know about his health status. And when he told me, I do appreciate his knowledge. And after that, I'm going to explain the condition and I'll explain the IBS. And after that, I'm going to explain to him the mode of our plan of management. And here there is no complications. I will tell him about the prognosis also. Yeah. And after
very good.
Yeah.
And after that?
Yeah, and after that, I will ask him about if he has any concern.
Okay.
And also,
Then?
I will ask about the social history and support and more resources.
Okay. So, Dr. Hanan, very well done. I will modify your few things, otherwise it's a perfect. Let's suppose we have any communication card in our hands. Okay. So we are going to divide this card into 3 parts. Okay. Any communication station, any category. You are going to divide this into 3 parts. Part A, B, and C. Remember one thing, Dr. Hanan, as you have mentioned, part A is introduction, then agenda, then do you want anyone else for a company, and how much how much you know so far about your health condition, and what's your expectation today. This is a fix. Part A will remain fixed with every category. Okay. So
yes.
What is the requirement of this then part A? Part A, it means once you have a fixed thing. So you need to be very fluent in these fixed areas, because you're not going to change anything in this area. These 4 or 5 lines, you must be very crispy and very fluent every day. What is going to be changed is the name of our patient or relatives. Am I right?
Yeah.
Yes.
Yeah.
So you can build. I have for example, I've written here over this slide a few lines. Okay. These are the fixed lines which I have built by myself, but I'm going to share with you. So in this way, you can just very simple and very short introduction. Hello. Hi, my name is Dr. Azhar. I'm one of the doctor today in this facility. I'm not going to mention any GI clinic, any neuro clinic, any joint clinic. No need. Maybe you will forget about that. In this facility, it's the umbrella term. It will cover everything. Okay. And this will give you a lot of confidence. Am I talking with Mr. XYZ? Once you have introduced yourself, you take the introduction from the surrogate, then mention your agenda, today's agenda. We are here to discuss with you about your health condition or about your father's condition, maybe your mother's condition. Is that okay with you? Yes, doctor. Do you want anyone else to attend this meeting today? Okay. If you are talking about their mother and father, if they are not lost their consciousness, just do mention here, be sure that your father or mother is aware of today's meeting. Okay?
Yeah.
Why?
Confidentiality.
Confidentiality. 110%. You are absolutely right. So you need to mention over here. Then ask about the I for idea. What do you know so far about your mother's condition, about your condition, about your father's condition? Then C for concern. Keep concern silent, coming to the E. After I's, do ask, what's your expectations from today's meeting? These are the fixed words. So you need to be very fluent in part A. Coming to the part B. Part B is always, you need to fight with the surrogate. You will have a big dramas over here. You will have tears, you will have anger. He might be shout at you, but be silent. Be keep yourself very under your nerves. So you are going to give the warning shot. I highly appreciate your knowledge about your condition, Mr. XYZ. As you have mentioned, so you were admitted in the hospital because of this reason. And unfortunately, the result of that reports are not as we hoped. These are the warning shot. Okay? And then please don't take too long. Never ever. Break a bad news immediately, because your task will be started after breaking the bad news. Break the bad news. These reports showed that you have a growth in your tummy which has been spread to the other part of the body. Immediately spread. Don't into the pieces. If you are going to give this information in the pieces, you will take too long, and your a lot of tasks in the end will remain empty, and you can lose your marks. Then sympathy, empathy, same fixed words, sympathy, empathy. I'm really very sorry for this bad news today. I understand this is very hard to have such news. Okay. You see, I can see that you look very frustrated or upset. Okay. But be sure we are here to help you and support you. We will try our best to give you full support and full care. Then coming to the draw picture to explain. Whenever there is a chance to draw the picture. We will do our cases in next session, and we will learn how to draw. But you need to keep one thing in mind. In the part area B, you need to draw. Every time you need to draw. And Dr. Hanan, what's the meaning of this escape? You can see escape.
Yeah.
What's the meaning of this escape? What do you think?
Is it to skip the drawing sometimes, or what? I'm
No.
not sure.
Yes. Look, I write here in the part, this is purple area, B, then draw, then surrogate, right? Three things. B, always you need to draw, and surrogate will interrupt you. And you need to escape from the surrogate. E for any condition, Dr. Hanan, remember my words, any condition, any disease, you need to put etiology, E for etiology.
Okay.
And S for signs, symptoms. C for complications. A for actions. P for plan, future plans. For example, if patient is having, for example, joint pain. Okay, he is having rheumatoid arthritis. How you are going to deliver this information?
So I will tell him the etiology.
Okay, tell the etiology. I am surrogate. Please elaborate your words.
Mr. XYZ, you have a medical condition called rheumatoid arthritis. Did you hear about it?
Do mention, sorry for the medical terminology. Rheumatoid arthritis is a jargon. It will consider as a jargon if you will not say, Mr. XYZ, you have a no. You have a rheumatoid arthritis. Sorry for medical terminology.
Okay.
Okay. If you will say only rheumatoid arthritis, it will consider as a jargon and it will deduct your marks. Any condition, celiac disease, sorry for the medical terminology. Ankylosing spondylitis, sorry for the medical terminology. MS, multiple sclerosis, sorry for the medical terminology, because he is not aware of any medical terminology. He is a hawker. He is selling fruits outside in the streets. He don't know. He is a patient. How he could know your medical terminology? Even the 50% of doctors don't know the terminology. Am I right?
Yes.
So whenever you are, putting some medical terminology, just do say, sorry for the medical terminology, and it will cover your jargon. Okay. Coming to the next area. Now deliver the information again.
Okay, Mr. XYZ, you have a diagnosis called medical terminology. Sorry, called rheumatoid arthritis. For the medical terminology.
Okay. Doctor, what
Did
is
you
this?
hear about it?
No, doctor, please tell me.
Yeah, this is a medical condition in which your immune system, instead of attacking bugs, it tends to attack your own body, especially in the joints
Okay.
and other tissue.
Okay.
And yeah, actually, we don't know what triggered this, but what we know that
No. Just do
Okay.
do mention you have done with the etiology. Now come to the sign and symptoms. It can
Okay.
cause a lot of problem. It can cause a lot of problem.
Okay, it can cause a lot of problem like joint pains, and sometimes it can affect your chest. It can affect your heart, and even your tummy, and it can affect your brain sometimes, and even your kidneys.
Okay, listen. Now you have take too long to explain the condition. Am I right?
Yeah.
I will give you a time-saving words. It can cause a lot of problem similar to your condition. He is a patient, right? He came up with you for the joint pain and swelling. He knows everything about that. Similar to your condition. If left untreated, it can cause a lot of problem. Now you can put few complication over here. No need to give the full clinical picture to the surrogate. Never. Just say it can cause a lot of problems similar to your condition. If left untreated, it can cause a few problem in your life. It can cause your destruction, deformity, or disfigurement of your joints. It can problem maybe with your lungs, with your heart, with your brain. So what we are going to do now, again, now complication you have done with the complication action. What we are going to do now, we are going to run some blood test, and I'm going to refer you to the team of doctors. Team of doctors, always 3%. You remember, this is a rule of thumb. Doctor, nurse, doctor, nurse, and social worker. If you forget any character, don't forget these 3 characters. You will find everywhere. Doctor, nurse, and social worker. I'm going to refer you to the joint doctor, specialized nurses, and a social worker. Specialist nurse, social worker. If you forget any character there, so do mention these 3 characters, you are safe. Then coming to the last is again this part is again fixed part. Concerns, closing contacts. Do you have any concerns yet, doctor? Is it a curable condition? I highly appreciate your concern, Mr. XYZ. It's not curable, but the symptom can be controlled. Full stop. Do you have any other concerns? After concern and closing, I'm going to share with you leaflet, brochure, and links of some websites. Okay, you will go through this website and you will understand better understanding about this condition. Contacts. If you have any query, any concern, I'm going to share with you my hospital contact number. You can contact us anytime. Full stop. And nice to meet you. Thank you for your today's time. Then you can end up in this way. Okay.
Okay. Yeah.
So this is how we can tackle our communications having a different categories. Let me share with you the categories here. I have one slide which will give us the categories. So it's better to practice with each other according to the categories. At least you will be familiarized with yourself with each one. Look at here. A few categories, 1, 2 categories missing over here, but I will add in the future. Breaking bad news, error, palliative care, DNR, procedures, complication of the procedures, drug explanation, side effects, disease explanation, then communicable diseases, needle stick injuries, angry son, daughter, uncertainty, and one more thing is genetic counseling. And one more I forgot to mention here. There is another total 15 categories you can face, but nowadays what we are facing most commonly is error. Okay, error is very important, and the procedure is very important. Recently, 2 days before, procedure was there, error was there. Complication of the procedure is very important. So first I think 7, 8 categories, they are coming again and again. Till 7 categories are coming again and again, and we will try our best throughout this August month. We will repeat these categories again and again, these 15 categories. We will cover each and every concern. We will cover each and every category of the communication. Is there any question so far in understanding of what we have talked today? Any question, Dr. Abdullah, Dr. Ali, Dr. Farah, Dr. Hanan is there, and Dr. Zubey is there.
In the first slide where there is complication, are we going with the possible diagnosis complication or even differential diagnosis complication?
First slide, right? You are talking about this slide.
Yes.
Just a minute. This one?
The one of LCC, yeah.